Mic test. Oh, no, this works. Nice. Before we start, I do need a little bit of help. So for the people on this side, what I was told is that I cannot leave this red carpet, okay? So if you feel like I'm about to come off, I want everybody to do this. For this side, if I'm about to come off, you have to do this, okay? Let's practice it real quick. I'm gonna act like I'm talking and, ooh, thank you, okay. And if I'm coming this way, thank you, awesome. Okay, now I feel comfortable now, because this wasn't part of my script, so now I feel much better. Thank you, first of all, and again, my name is John Lee. I am a faculty member at the Department of Physical Therapy. I'm an assistant professor and also a researcher there. I purposely kind of kept this slides a little bit more of an old school style because, as one of the few faculties talking about it, I wanted to give a little bit of, not really a lecture vibe, but, it's just kind of bring you back to old time, back into classroom. So let's talk about why we hurt differently. I'm going to do a quick guided imagery for everyone, okay? I want everyone to close your eyes. Think about a peaceful weekend. If you're a dog person, cat person, your companion animal sleeping right next to you, temperature is perfect, sunlit room, whatever the definition of your peace is, you have it right now. And then I want everybody to open your eyes because you just stepped onto this. Ouch. Not a great sensation. Pure pain. So there is something universal about pain itself, that we often think that it is a common language that everybody speaks, but there is something slightly different based on who you are, and that is something that I want to talk about today. So once you step onto it, I don't want to take you to too much of science class today, but there is nerve receptors that's going to pick up your pain signal, and then that carries all the way through your body. It goes into your brain, and then it says, ouch, please pick up your foot because I don't want to experience pain anymore. So that's everything that goes on, which is universal. In fact, that is something that regardless of who you are or no matter where you live, you're going to experience that. But what about after that? What happens? How much are you allowed to share or how much are you allowed to show? Because some of you might scream as loud as you can to let the rest of the world know that you're in pain. Some of you might keep it completely silent and not show a single evidence of pain because that's how you were taught. Some of you might call your partner or call your children, call your parents, telling that you're in pain, or trying to accuse who let that Lego piece in there. But depending on how it is scripted in your culture, that is going to decide how you're going to respond to it. So there is something slightly different compared to something that's more universal of it. In healthcare, including myself, we are trained to assess pain. So there are some questions that I would ask, such as, on a scale of 0 to 10, what is your pain level? Or does it make your pain pattern better if you do this? Or if you are sleeping, does it make it better? If you take medication, does it make it better? So there are a bunch of questions that we do ask. And even in my lab, I use something called digital insoles, so that goes under my foot, inside of my shoes. And then I can measure very detailed pressure points, kinematics of what level of pressure or angles that is occurring when you're walking, right? But all of that information doesn't really help me to understand what type of pain that my patient or clients are experiencing. There's definitely something more to it. It's not just the number of pressure that is occurring within the foot, but usually there's a different meaning of pain for everyone. And that starts really long time ago. It's not just an instant moment or experiences. Rather, it's more of an adaptation and history. So sometimes because of that, we make mistakes. For patients who are quiet, sometimes we label them, they're fine, right? Sometimes our parents or our siblings who are quiet, we kind of think that they're okay. They're not complaining, they're fine. We think about that. Sometimes they're expressive, and so we call them dramatic. That's how my family would call me, dramatic. But there's more to it, I promise. And if we have patients or clients who are somewhat hesitant, should I open this information to Dr. Lee, or should I let everybody know about this, or is this really going to work for me? Should I do this? If they're hesitant, we often call them non-compliant. And lastly, if they're so cautious, they're nervous, if they're so guarded, we often call them they're difficult patients. And these are because we're so quick to judge, we're so quick to label them. We live in a society that rewards speed. We want quick diagnosis, we want quick fix, we want quick everything, right? So that's why we're so eager to just label everything without trying to understand what's really going on with them. So going back to how this is really an identity built on your history and adaptations, it really starts from when you're little. When I take patients who are underage, when they're children, usually for the intake form, when you go to the medical office, there's a bunch of paperwork that you have to fill in, and there is a section called occupation. And for children, I never hesitate, and I just write down that their full-time job is to play. Because that's what kids do, right? That's what children do. But however, with playing, unfortunately, there is a package deal that comes with, which is falling. They fall. I fall too. I'm very clumsy. My biggest concern for today was that am I going to trip on the stairs or not today? So we do fall, but children, they really do. And when they fall, especially each of you, when you felt, when you were little, you might have heard something like, big girls don't cry. Man up. It's going to be okay. Let's go. Don't make a scene. Or it could be something like, come here, let me see. What do you feel? What's different? What's going on? Tell me. Don't cry, but just use your words. So everybody kind of use different strategies and different words. We kind of call that background. We call that culture. One word cannot really describe that, but that experience is different for everyone for sure. And once that experience adds on for years and years and years, then they internalize it, it becomes part of their identity, and it's also attached to their instinct. So it's not just a moment of stepping on your Lego, but it really carries over in terms of what has been happening for your life. And it's not just for clinic spaces, it's everywhere. These type of painful experiences, such as at marriage, one person might talk about certain experiences over a fight, whereas the other person doesn't want to talk about it or needs time to sleep it off. Whereas within the family, sometimes sacrifice is given. It is expected. It is expected for you to carry that burden. Within friendship or schools, sometimes there are multiple experiences or types of feelings that are occurring: loneliness, anxiety, pain, all of that. But you kind of shoo it off because you don't want to give the bad energy to others, right? So you kind of try to keep it to yourself. I was like, I don't want to be that person spreading apart the bad negative energy for it. So sometimes you kind of internalize it. Or even within the workplaces, we have that coworker who would kind of keep it to themselves until they break without really telling people that they need help. So all of these things are happening everywhere. It's not just clinical spaces, it's not just at home, but it is every day that we live in. I've seen patients in so many different settings who would say things that didn't really make sense to younger John Lee when I started my first few clinical experiences, right? I would go to the patient room at the hospital whose both arms and both legs are broken, but she would tell me that she's fine. And in my head, I'm like, are you fine? Are you okay? But she said she's fine. And then I also have somebody who told me that this gentleman dislocated his shoulder and that he's feeling terrible, but he wouldn't stop joking about it. He feels terrible, but he's joking and laughing. So that's how he was coping. And also, I'll hear things like, oh, it's nothing, but the person is crying. Or sometimes the person doesn't even know how to articulate the experiences that they're going through. So these painful experiences or everyday pain was showing up in so many different layers for me. It was written in language, it was written in their expectations of their life, and also it was within their culture itself, really how they would like to keep their relationships for. So those clinical experiences really taught me that, okay, so people are really internalizing this differently, and how they're projecting it, it's so unique. I can't just judge them so quickly. So that's why I really like to talk about this topic, because I want more people to think about it, right? This topic of cultural competence. Cultural competence is not just a academic checkmark that we have to have just to make my curriculum look nicer or just to make me look like I'm compassionate, but it's a powerful tool that helps us to utilize. It's a humility that allows me to pause and think about, I don't really understand what you're going through right now, but I'm not going to judge right now. I'm going to pause. Also, it is a willingness that I'm going to stay curious. I'm going to ask you questions, and without judging, I want to know what's going on so that I'm able to understand you. And also, it is active love to me because it may not be a sentimental love, but it's an attentive love. It's a practical love. It's an act of love that you're able to understand each other, because that's where healing begins. Once you're able to connect and understand each other. So according to research, there are a few things that helps us to try to make a shift for, which are, number one, try to not to make a judgment too quickly, and then stay curious, right? When your mom tells you that she's been having a back pain for so long, instead of yelling her, saying, how long has this been going on? Why didn't you tell me? Instead, pause and think about, I wonder why she didn't tell me. I wonder why she waited for this long. What did it mean to her? Why would she wait for this long without complaining it? Also shift from measurement to meaning, or meaning making, really. Instead of just trying to understand the volume of pain, but really trying to understand what it means to them. What are they afraid of? What are they losing? What are they still trying to do? So shift your focus, and don't get me wrong, I'm a researcher, so good data, good measurement, don't take that away from me. I do need that, but you get the point. We also want to overall shift to the meaning making. And lastly, instead of instantly trying to fix something, try to just witness. Try to stay that moment of togetherness. Because, again, with this world of fast answer-seeking culture, sometimes it's not about giving the answers to each other, and sometimes there might not be an actual answer for it. You just have to be there, listen, and then really understand what's going on. And once you're able to understand or being understood, that's really the healing begins for any type of pain that we see in everyday life. It doesn't have to be a huge pain. Again, we're not trying to measure it, right? This type of ordinary pain is everywhere. It could be coming from being misunderstood from your friends, pain of not being chosen, a pain of staying away from home, the pain of anything that you can think of. Those ordinary pain all starts from understanding each other. So if you can take away one thing, this is something that I like to emphasize for my students. So cultural competence is not really just understanding what the differences are, but it's about refusing to let those differences become distance. So always stay next to your loved ones, and then be ready to and be willing to listen. Thank you very much.